There are no confirmed cases of COVID-19 in Belize, and right now, Belizeans are able to move around in country. But that may change if we get cases of the novel coronavirus. Persons of interest may have to go into self-isolation or quarantine for 14 days. And other more serious preventative measures, such as a lockdown, can be instituted based on the situation on the ground. And so to prepare oneself and home if you're faced with more stringent measures, persons may want to put together a small kit of emergency items, such as prescription medication or a few over-the-counter medications. Families with young babies and elderly persons may also want to prepare for these vulnerable groups just in case. Here are a few recommendations from a critical care doctor, Jorge Hidalgo.
How we can get prepared to have an acetaminophen or Tylenol, who is the same at home, is advisable. Have enough water, and of course, as again the different type of supplies that you most of the time need for a period of 2 to 3 weeks. But importantly, in case we have patients in the group of the vulnerable people, that means that these patients probably we need to make sure that they have supply of medication for at least 2 weeks or a little bit longer. In case of patients with hypertension, have failure, if the patient have diabetes, we need to make sure that they have the different type of medication, either insulin or pills that they use to control the sugar. If you have babies, supplies to take care of the babies for a period of time of 2 weeks. In this is the case that we are going to face a situation like that.
While it may be useful to purchase some non-perishable goods as well as your favorite food items, it is important not to stockpile. Groceries with longer shelf life are good to have, but you can also keep a small supply of fresh goods which are good for your health. It is also important to have water in your homes.
We don't need to wait until that information gets. No, I think so at this point we can start to get some of the things that we know that we can have it for a week, for 2 to 3 weeks. No, probably in that case some of the canned foods is going to be reasonable. Of course, we need to make sure that the expiration date is good. Depends on what is your water supply. Also, we need to make sure we have a good supply of water, because water is important. We need to make sure we can keep your hydration. Most important than anything, again, we need to have a plan at home, a plan of action in case the situation could be that bad. Hopefully no, and all of us are praying that this is not the case.
Cleaning and hygiene supplies for hand washing, bathing, laundry, and general cleaning, as well as disinfectants to keep surfaces clean, are important to have in your homes. But Dr. Hidalgo stresses that in the event someone in isolation gets sick or there's a lockdown, you should call the relevant health authorities first.
And the most important thing if we get sick is, and especially with respiratory symptoms, is trying to stay at home and call our the health provider just to explain the symptoms. If we believe could be related with that, in the event that we get in touch or we are coming from a country with exposure. No, if this is not the case, we still recommend that you stay at home and contact your health provider to receive instructions. No.
Reporting for News 5, I'm Andrea Polanco.